What motivated me to become a plastic surgeon was during medical school, I was exposed to many specialties, and one of the specialties was plastic surgery.
Well, my father was a surgeon, and when I started medical school in Chicago, the first 2 years is academic training. The second 2 years you do these courses in different fields of medicine, whether it's surgery, psychiatry, family practice, pediatrics. And in my third year of medical school, I was assigned a rotation on plastic surgery for a month.
People have a misconception that plastic surgery is just cosmetic surgery. But the history of plastic surgery started from World War I and World War II to reconstruct all the disfigured, wounded veterans. And so plastic surgery was actually reconstructive surgery.
It just so happens that one of the residents in the training program was Dr. Kim. What really impressed me was, number one, the residents were thrilled to be there.
We don't use any plastic materials. The word plastic is derived from the Greek word plastikos, to mold and shape. And so that became the name for our specialty. I found out that when any of the other specialties, whether it's OBGYN or general surgery or neurosurgery or orthopedic surgery, if they had a very difficult problem, they would call the plastic surgeon to come and help them out.
We weren't doing the same thing every day. It was a pediatric cleft lip one day, a breast reconstruction for breast cancer the next day. And so every day was a different challenge. It was artistic, there was a lot of variety, and I knew almost immediately that that's where my interests were going to lie.
Now, from a historical perspective, organ transplantation as we know it today, such as liver transplants, heart transplants, was first started by plastic surgeons. We studied organ transplantation using skin, studying all the rejection studies, using skin from other people. And so that became the basis for transplanting organs. And that was championed by a plastic surgeon named Dr. Joe Murray in Boston, who won a Nobel Prize for organ transplantation. But nobody knows that this was all started by a plastic surgeon. It's not just cosmetic surgery. It involves hand surgery. It involves reconstructive surgery after traumatic deformities, birth deformities. There's a whole gambit of many things that we can do as plastic surgeons. So that's what motivated me.